Instagram Sunday. Good morning to all of you guys. This week we're going to be talking about the nerve. As you know, for a long time we've treated people with the ulnar side of wrist pain, and we see a lot that have ulnar nerve and radial nerve issues. We don't see a lot of median nerve. So what I'm hoping to do today is to demonstrate what the nerve is, where it goes in a very broad manner so that you understand how to look for nerve symptoms and figure out where those nerve symptoms are coming from. So we're speaking to, I'm not going to get very technical or very specific, just give you a general idea of how the ulnar nerve moves through the human body. All right, let's focus first on our friend Harry. Harry, what we have here are three nerves that come out of the spine, and they come out at this level, kind of under your chin. And there's a radial, median, and ulnar nerve, and they come together and then divide off, and they send little feeders out to different parts of the upper body. But they come out to the nerve. This is the median, this is the radial, this is the ulnar nerve, this is the hand. We start all of our anatomy with anatomical position, which is palm up, elbow straight, lying flat on the back. And you can see here that the nerve has a length that goes all the way up to the spine. And it doesn't just stop here. It continues down through these spinal nerves and go out to the toes and up to the brain. And so tension here is not just here. It usually translates into other areas. So if you put one of these nerves on the toe and you bend the toe, this actually moves. So it's all interconnected. But today we're just going to start with here. And we're going to talk about the ulnar nerve. All right, so what you can see in this position is when you bend the elbow and you extend the wrist, this puts tension at the ulnar nerve here. You can also see that if you flex the neck, extend the neck, laterally rotate or laterally flex the neck, you get also a stretching of the ulnar nerve here. All right, let's go over here to lovely young lady. And again, we start with the assessment of the nervous system in anatomical position. Spine straight, pelvis tucked, chin to the cervical spine straight, shoulder neutral, 45 degrees, elbow extended, wrist extended. That's a neutral position for the ulnar nerve. And then what we want to do is figure out what happens when you flex the neck. Just flex the neck. And nothing happens over there to the ulnar nerve. And then extend. All right, and then do lateral, so this way. You notice her arm tries to come over, that's normal. And the other side. And then rotation. So just rotating the neck this way. And then rotating the neck this way. All right, now go ahead and curl your pelvis up and the other way. Yep, and again. Yep, okay. So now we're going to combine motions. We're going to go lateral flexion and rotation. And that, there we go. That causes the shaking on this side. All right, and we're going to go lateral flexion and rotation. And that causes shaking on that side. So what we have here is a irritation of her nervous system. So you're going to bend your elbow, extend the wrist. Now you're going to move your neck over, relax your hand. And let me know if you get symptoms. You see how the pinky is now tremoring? Back in neutral. Let's see if that causes it to tremor. And then move it back over on a stretch position. And then it tremors there as well. Now rotate. And that really makes it tremor. All right. So, if your nervous system is sensitive there's a lot of reasons that the nervous system can break down. Lots of reasons. Chemical. So you can have a neurotoxicity from a lot of different things. Bacterial, viral, lead, magnesium, or mercury. You could have physical, which is a direct trauma to the nerve, so clavicle fracture, a spinal cord injury, a shoulder injury.
We have a request for a live.
Oh yeah, okay. So there's a lot of reasons why the ulnar nerve can be affected. We're seeing a lot of chemical in autoimmune problems and in bacterial, viral, and parasite infections. We see it with iron deficiency. Ulnar nerve is, it requires a lot of nutrients to function well. It requires iron, magnesium, particularly. So the first thing I recommend for somebody with ulnar nerve symptoms is to figure out if your ulnar nerve is irritated. Next is specific. I'm going to show another way. Some people whose ulnar nerve are just affected mildly, they will only get the symptoms when they put on maximum stress, which would be arm inflection and out here. And this would be your back is extended. So you can see, you can check to see if your ulnar nerve, where on the spectrum of stretch it starts to light up, and if it's bilateral. So I hope this is helpful. So one of the things that we use for helping people with ulnar nerve problems.
Hi, are you live right now? Can you hear us? They said they can't hear us because of the live broadcast. Do you know how to get out of that person's?
I want to talk to you guys about neurocore.
They can't hear us right now.
Oh, they can't hear?
Yeah, someone tried to go live. Hi, I'm sorry, we can't hear you, unfortunately. I'm gonna have to go out and come back in. Oh, there we go. Okay, perfect.
All right. I would like to talk to you about estim. Estim is a tool that we have to help nerves, and it's really remarkably effective. And so what you would do if you figure out that your ulnar nerve has been injured, let's say it's at the hamate here. Let's say you fracture that, and this ulnar nerve gets irritated. So what you'd want to do is put the estim above and below it. And so in that case, it would be here, here. It's at the cubital tunnel at the elbow, maybe here and here. And it doesn't have to be perfect. For this young lady, it's really a systemic starting at the spine. And so what we do is we put it here and here. And there's a lot of variations to this, but you want to get a good contact. Turn the machine on, pick your setting, and then increase it so that you get a contraction at the right at the nerve. And after a very short period of time, what you'll notice is that your symptoms are less. And you just increase I'm going to slowly increase it here, okay? Just increase it, and what you'll see is this muscle contraction. And these can be very, very helpful for neuropathic pain. Let's see how it goes all the way down to our arm. Now I'm getting radial nerve right now. It's very hard to differentiate the radial ulnar and median nerve here because they come together and split apart. But you can play around with these and find what works best for you. So NeuroCore is a good, this is a wonderful tool. There's lots of different estim units, lots of different variations, lots of different applications, but for ulnar nerve pain, it's quite helpful. The other thing is we can strengthen the spine. And I recommend this for everybody that has nerve problems. So if you have a systemic nerve issue, any sort of activity or strengthening here is only going to irritate things, because when you contract the muscle, it tugs on the nerve. So I recommend starting with a neck flexion spinal exercise regimen. Bend your knees just a little bit. Place your hands over here. Tuck your chin in and curl up. Go all the way up. All the way up. All the way up. All the way up. Go again. Okay, we start with neck flexion or spinal flexion, and you strengthen the muscles along the spine. Go ahead and go back really slowly, really slowly. One vertebrae at a time. One vertebrae, curl that hip under. One vertebrae at a time. And what you're looking for is if you get a zing in your nerve. And people with radial nerve problems and an elevated ulnar head, what you'll find is that this may give you a clunk in your wrist. And so when you place your hands here, the elbow is neutral, you're not grabbing, the wrist is in neutral, the shoulder is forward, it's not on stretch, it's on slack. Pay attention to this ulnar head as you go ahead and do this. Now, if your ulnar nerve is systemically irritated, or if you have a pinched nerve in your spine, what you'll find is this irritates your ulnar side of the wrist pain. So go ahead and go again, flexion. So, yeah. Don't move your arms next time, just place your hands here and go back. So you don't move your hands, you just keep your hands stable in one place, and you go one vertebrae at a time, and you pay attention to the ulnar side of the wrist. All right. After flexion, we do extension, lateral flexion, and then rotation. So lateral flexion would be this way, and then rotation would be this. So your objective is to identify which rotation, flexion, or extension irritates that ulnar nerve, and then strengthen the spine around that. If you can tolerate that, then you move outward and start adding the shoulder. But you don't do overhead weightlifting at all until the nerve calms down and you can lie in anatomical position without any symptoms. All right, I'm ready to take questions. Okay, certain blood tests that I like is a CBC, iron, B12, vitamin D, magnesium. The magnesium test is not that accurate, but it's helpful. STDs, autoimmune test for Lyme. We don't see a lot of lupus. We do see a lot of rheumatoid. And so Lyme, a tick-borne panel is helpful. Yeah.
We have a question from L. Hayes. He asks, I had cubital tunnel decompression on my right arm, along with this, my right wrist, possible FCU tendinopathy. On the inside of my wrist, I have a small bruise.
When did the bruise start? Okay, so what they do in the ulnar nerve transposition is they take the nerve here, and they move it to the inside. So they start up here, they cut down, and then they move the nerve out and they put it underneath. And what that does is it takes tension off of the ulnar nerve. So it relieves it of tension. But it does create scarring, and it does create the scarring, and it can cause a wider area of pinching. So with ulnar nerve transposition, you got to do a lot of work of scar mobilization and muscle strengthening. You really have to strengthen the triceps. What I find more often than not in ulnar nerve problems is that it's a systemic issue, and it just, from a large range of things that can cause that. There's a long list of things, but usually this ulnar nerve problems.
He says that it happened about 2 years ago.
Okay, and so now you've got your bruising here? Or after the surgery? When did the bruising start? All right. In all cases with cubital tunnel, I do aggressive strengthening of the shoulder blades and of the triceps, all of them. And that really changes if your nerve is not conducting well, then the muscles that it innervates don't work as well. And so you've got all these other muscles that are supplied by the other nerves that can help it. So tricep strength is really important. Lat strength is super important, and scapular mobilization exercises are really important. Really, really important. But you got to start at the spine. You start at the spine and do a lot of mobilization of the hip and some strengthening of the spine so you can tolerate a plank. And then you move to dynamic scapular exercises, then triceps, and then the extensors. So a lot of people do primarily flexion exercises, bicep curls, wrist curls, and you don't, although those are very important for generating grip, they because of the challenges that they may cause and the imbalances that they cause, the tricep strength, lat strength, and scapular strength are super important for most humans. Yeah, I hope that's helpful. But that FCU, just so you know, that FCU is right here, and so oftentimes if you have an ulnar nerve injury, it's easy to confuse irritation of the ulnar nerve here with flexocarpi ulnaris tendinitis. So probably the better way to understand how your nerve is doing is to measure your grip strength. Get your grip strength and your pinch strength compared to the other side.
The decompression surgery was in January of 2021.
Oh, recently. And the flexocarpi ulnaris is when that?
He didn't say.
Yeah.
We have another question as well.
Yep.
From Squincher3. I had surgery in November for a TFCC tear, SL laxatiy, and an abutment lesion on the lunate, and I still have the same problems as before, as well as a couple more minor issues now. Any thoughts?
A lot.
The TFCC was a delamination tear that extended up into the ECU subsheath, or
Okay.
heath, subsheath.
All right. Okay. Yeah. All right. Once you have surgery, you muddy the waters. It's harder to see through the clouds once you have surgery because it just is an additional injury with the surgical incisions. So what I would start with is understanding what the weight-bearing tolerance is and your grip strength. Those are the two tools that we have to measure accurately where you are, how stable your wrist is. You can sit. You can sit. Okay. You move over here, and I'll just move over here, and we can go over here. All right. So this young lady had bilateral TFCC tears, and the question is, was the tears caused from the ulnar nerve issue, or was it a secondary problem? I think it's primary. I think the ulnar nerve gets pinched or irritated and not conducting well, and then it affects the strength of the wrist, and then the tension. You can't tolerate the tension. So for you, all right, what you have to do now is you got to understand what your grip strength is. And the best tool for that right now that's objective is a dynamometer. And you just find somebody that can give you a good measurement, or you get there's some tools online that you can measure your grip strength with. These little, now they're electronic little grippers. And that's a good place to start. Understand what your grip strength is, right and left. And then do your weight-bearing numbers. And you want to make sure in your case that you're doing it really controlled, so you've got it in the right position. That's the same position that you do every time you test it. Elbow is straight, you push down and get a good number. And then what you want to know is how does that change when you squeeze the radius and the ulna? Because if you squeeze the radius and the ulna together, you're supporting the TFCC, and what that'll do is it'll tell you the status of the TFCC. So you're measuring the grip strength, and then you're measuring your ligament stability. And then you watch that over the course of time. You can't do any strengthening until you have 60 pounds, 60, 65 pounds of weight-bearing stability. It doesn't do anything. So get your stability back, and while you're waiting for your stability to return on your TFCC, you're doing ulnar nerve stuff. So you're really trying to understand how your nerves are functioning in your upper body. Is the radial nerve tight? Is the ulnar nerve tight? Do you get tension symptoms? And if you do, then you start a program of strengthening this while this is healing. And what you'll notice is as this kind of starts to improve, then your grip strength will return. So, but if your root issue is systemic, none of this helps. Surgery doesn't help. Strengthening doesn't help. And it gets irritated really easily. So you've got to still have a lot of discovery in your understanding of what's going on with your unique body. But the main things all still apply. You need grip strength and wrist weight-bearing tolerance for function. And you want to use those as your guide. So weekly check your strength, go get some blood work, make sure that is all good, make sure your ulnar nerve, radial nerve are moving smoothly through your whole upper body. Grip strength and measuring every week and monitor that over the course of time. And as it gets more complicated, you got a TFCC, you got an ECU, you got a nerve. It just takes a little longer to unwind all of that.
Okay. Squincher says, I've got about half grip strength in that wrist. I've been going to OT after I was out of the cast, and I've done your weight bearing test. The wrist widget helps. They're also getting another MRI done on Wednesday with a nerve study.
Yeah, now the nerve studies are not that great. In order for the nerve study to come out, here's the thing. So nerves, everything. Your arm cannot function without a functioning nerve. And an injury to the nerve where you have loss of conduction is a serious thing. And you have to move quickly on what you do because you don't want the nerve to stop working and the muscles in the hand to stop working. But the nerve conduction tests, they're not going to come out negative unless there's a really, really significant loss of nerve conduction. So you could have somebody that has shaking of the nerve and loss of grip strength of the nerve, and their nerve conduction studies come out normal. So it'd be good to know what those, that's going to dictate how and what you do, but most of the time those come out normal. And so then the question is, why are your nerves not working? What's going on with your nervous system? Is it at the neck? Is it at the shoulder? Is it at the elbow? Is it at the wrist? Is it systemic? So that takes kind of first priority. I want to know how much weight-bearing improvement did the wrist widget provide? What change? Did they get a response? Yeah. Just tell me what your change, your weight-bearing numbers are, and what your grip strength is. People with ulnar nerve problems also have loss of endurance, so they really peter out quickly, and they do all kinds of compensatory stuff as they use the radial nerve and median nerve muscles to pick up the load.
L. Hayes sent us a video or a photo of his wrist, but we're not able to view it. L. Hayes will reach out to you after.
Yay!
Yeah.
Yeah, send us a note. And, send us your pictures and videos too. This is a lot more common and needs to be really understood better because doing surgery on the TFCC when you have an ulnar nerve issue is risky.
Squincher says, pretty close to uninjured wrist with wrist widget on.
Oh, what was it without? That's good. Okay, so you're getting more stability with the wrist widget on. That's important for function, but what did you start at? So the extent of the change in your weight bearing tells you the extent of the injury. Mm-hmm. So if you're starting out really low and then it goes to normal, that means the central portion is involved. It does take time. So.
Oh, interesting. So L. Hayes, he says when he got diagnosed with cubital tunnel, I had nerve conduction. Mm-hmm. When I had the surgery, the doctor said he had 6 trapped nerves and 1 inch above my nerve was swollen. If it's that bad, could that affect my wrist?
Yes, absolutely. Yeah, absolutely. Absolutely. You lose endurance and you lose strength on the muscles of the hand. So your flexors for the ulnar nerve get affected, your grip strength is affected, and so if you don't have the strength to support motion, your ligaments are going to take that load, and you will have a higher incidence of injury to your wrist when the muscles aren't working well because the ulnar nerve is not happy. That's an interesting case. So what you're saying is that when they go in and they do this surgery, you know, they fillet the forearm. It's quite remarkable, actually. So they go up and they slowly dissect, take the skin and just open this all up. You know, depending on what they see here, you know, they start in a small area, and depending on what they see, they may go up further to investigate and distal to investigate. And what you're saying is that this physician found points of impingement, which are really easy when you go in and you look at the nerve in a human body. You can see where the nerve is trapped. They found a bulging here. So there's a lot of reasons that can happen, a lot, but essentially that means that they had to cut you a little further here, and they probably went and explored distally. So you have a bigger scar, and then when they moved you over like this, they just take the nerve and they just move it over, and they take the muscle off and then put the muscle back on, which is remarkable. And you know, taking a muscle off of a bone and putting it back on the bone is a big deal. And then moving the nerve over is also a big deal. But if this nerve is injured and you have loss of conductivity out here, you got to move quickly. You don't want it to die. And so that's why they oftentimes say they move pretty quickly on these things. So yeah, and these take a while to recover.
L. Hayes says that's exactly what happened.
Yeah, they take a while to recover. They just do. They just do. I would highly recommend that you get an estim unit.
What one do you recommend?
Well, there's a lot on the market, and all of them are fine. They have different variations in what they do, in the amount of electricity, how the electricity is administered, for what purpose. I like this one because I've been using it for nerve pain, and it's quite effective. Yeah.
My Touch from NeuroCore.
Yeah, I just like this one. It's easy, it's simple, it's a little bit more expensive, but I like the outcome for nerve pain. So it's just my choice.
Oh, Squincher says she can't remember, or they can't remember precisely, but they're thinking it's around 40 to 45 pounds.
Grip. Barely functional. Really, 40 to 45 pounds of grip is just enough to do most tasks around the house except for heavy lifting.
And if it's 40 to 45 pounds of weight bearing before the wrist widget?
What did it go up to after the wrist widget?
It said they didn't know the numbers exactly, but it barely changed with the wrist widget on.
Oh, this is different than the other person.
Yeah, Squincher.
Yeah, so if there's no change in the weight bearing numbers with the wrist widget on, your TFCC is fine. Plain and simple. Just fine. But 45 pounds of weight bearing and 45 pounds of grip, usually your weight bearing is a little bit more than grip, about 15%. So you need to know those numbers. Those numbers are everything. So, when you do the rapid alternating grip test, write those numbers down and then retest again to watch it over the course of time. Normal grip strength is 60 pounds. You need 40 to 45 pounds for just function. That's not carrying an iron skillet. That's not carrying a 10-pound bag of dog food. That's not carrying your children. That's just 45 pounds of grip strength is what you need for basic tasks around the house. So, yeah, that's not a lot. What's the 30?
We are at 10:30. We do have a couple more questions.
Great.
Deckley wants to know, how do you determine where to estim?
Yeah, really good question. So what I would do is I'd start on your back and mobilize your spine, just like we were doing. Tilt your pelvis, elongate your spine, move your neck, and figure out if you move your neck, if your symptoms start up on your wrist. And if they do, then start here, up here. You can also put it where it hurts. So if you irritate your nerve, whatever nerve it may be, you can put it around that area. The electricity that's administered by this is broad, so it doesn't have to be very specific. You can get specific if you want to, but in general, it's fairly broad, so you can't really do harm.
Okay. L. Hayes says, so they said it could take a year for the nerve to recover. So I guess it's a waiting game with the wrist, but continue doing strengthening exercises?
Yeah. They do take a year. They do take a while. The main reason why I'm doing this video is so that you can understand where the nerve is and how it moves through the arm and how easily it is to be stretched, and how you have to be observant of strengthening exercises and how they may irritate that nerve. You got an irritated nerve, you don't want to sit around all day. You want to do something that you want to live your life. So they're strengthening the core muscles of the body, super important. Follow our series that we have on neck flexion, neck extension, lateral flexion, rotation that we're going to be adding this week and then we'll be posting. Planks are super good. You can do them lying down at first, and we'll go over that. You'll see those videos that you can get more progressive doing standing against a wall. You walk. Walking is super important for the human body, for the nervous system, because as you swing your arms, as your legs go forward and they do an opposite direction, your nervous system is doing a gentle stretch. So walking is super helpful. You can walk hills to get cardio and also stretch the nervous system without irritating you. Don't be strengthening of the bicep, of the shoulders and stuff. It just irritates things more often than not. So I don't recommend that in general for nerve symptoms and pain in the arm. All right, is that it?
Squincher says the uninjured wrist was around 140 grip strength, if I remember, non-dominant hand. And then the right hand, which is the injured wrist, was around 70 for grip strength.
70 is good, but that's a big loss. That's a big loss. That's a big loss. Do you know what your weight-bearing tolerance was? Because it should be
weight-bearing test was 40 to 45, and then grip was around 70.
Yeah, that doesn't fit. Something's off there. You can't do 70 if you've got 45 pounds of weight bearing. Something's off there on the test. Send me an email, info@wristwidget.com, and I'll take a look at your case. But let's get some better numbers that make sense. Grip strength shouldn't be more than your weight bearing. So your weight bearing number is off there, and that'll change everything that you do is those numbers. So let's get some good numbers. Just remember, everybody, do a non-digital scale. Digital scale. Go out and get a scale. Spend the $10 to get a scale because it gives you a lot of information about what's going on in your wrist.
And then L. Hayes says, thank you so much, Wendy, for the help. I really appreciate it.
Oh, nice.
2 exclamation marks.
Oh, nice, nice. I hope that's helpful, and send us your questions if you have them, and we'll see you next Instagram Live. Happy Sunday to all of you, and happy healing.